Hello, friends. Today I'd like to address the symptoms of coronavirus. As you know, many people, the sickest people, get high fevers, cough, and shortness of breath. However, as I mentioned yesterday, the majority of people will only get either no symptoms, mild symptoms, or moderate symptoms. Almost like when you have a common cold, where you have malaise, which means that your body aches, you feel tired, you feel just not well. One of the things that has been recently believed to perhaps be associated with the coronavirus 19 is loss of smell. And I say maybe because we're not sure. There's an association that people have said that maybe that is associated to it. There can also be nausea, diarrhea, and maybe even just a general sense of not being well. The good news is that the majority of us, if we get it, we're going to be okay. We're going to get over this just like we get over the flu or the common cold. The good news is that we're going to be okay. The majority of us are going to be okay. The second thing I'd like to address is the use of non-steroidal anti-inflammatory agents, also called NSAID. These are things like Aleve, Motrin, ibuprofen. And there's been an association, again, anecdotal, which means that somebody has told somebody else. It's a rumor more than anything else, that patients that used those drugs, including aspirin, did worse than those that did not take those drugs. This started with the Prime Minister in France. I have not heard any position from the FDA or the CDC on that matter. I don't know from a scientific standpoint why that would be. However, if you want to play it safe, Tylenol is always an alternative that you can use. Finally, I'd like you to continue to give me all your questions. I have a YouTube channel now. I have this channel. You can messenger me your questions. And I'd like to for you to ask me the questions because I want to meet your needs. I want to be the channel of information to answer the questions that you have. So please continue sending me information and sending me questions so that I can do some research and I can answer them straight to you directly with honesty and with the truth. And now I'd like to just step out of this role and get into a role that is like everybody else. Because this virus is affecting all of us. It doesn't matter if you're indoors, doesn't matter if you go to work, it doesn't matter if you are alone or with your family. This virus is changing how we do things every single day. Some of us may be anxious, not knowing what to do. We might be so upset, so scared. Some of us may be very depressed. Very depressed. This disease has caused us to have social separation. But I want to remind you that social separation is a physical concept. It's not a concept of people not communicating with each other. It's important that you continue to text people, call people, FaceTime people, Skype people, whatever technology that is available to you, use it. Keep in touch with your friends. Keep in touch with your family members. Some of us are eating too much because we're nervous or we're anxious or we're depressed. Some of us are not eating enough for the same reason. Please, don't only take care of your body, take care of your soul. Keep in touch with people. We are social people. We are social beings. Please, keep in touch. Check on each other. Check on your neighbor. Check on your friend. Check on your aunt or your uncle on the other side of the country, on the other side of the world. Keep in touch with each other. Make each other laugh. I know it's hard. It's difficult for all of us. But please, for now, stay home, stay safe, and stay tuned.